Fantastic, very good. So yes, Dr. Sami, so please, the time is for you, the stage is yours.
Okay, thank you very much for having me on this webinar today. And yes, I think this is quite a topical subject, the microbiome. It's something which we haven't really focused on so much in the past, in terms of fertility at least. It was mostly focused on with regards to the gut, the GI system. But we've learned from our colleagues who are studying this in the gastrointestinal tract that microbiome has so many effects. I mean, we now feel that the microbiome can affect things like even psychiatric effects and mood and other metabolic effects than just affecting locally in the GI tract. So that's where the interest in the microbiome came. Next slide, please.
Oh, yes, yes.
Yeah, okay. So what is the microbiome? I think most of you probably will know, but just a quick, brief intro. So the microbiome is basically the microorganisms which live inside systems in our body. And there are trillions of microorganisms living in all the different systems in our body, which will be bacteria, viruses, fungal cells. Now, they actually are important for our health. So some of these are actually helpful. They actually have useful functions and they protect us from harmful microorganisms. And that's something which was really not thought about in terms of the reproductive tract. But yes, we're finding that this is a big player actually. So in this presentation, kind of going to go through what the microbiome effect is on fertility and miscarriage, because that's my field, that's what I'm interested in. And we'll talk about a few species of bacteria that are important here. Next slide. So the guardian or the policeman of the microbiome is the lactobacillus. So lactobacillus is a type of bacteria which in the healthy vagina should be dominant. So it should be the most abundant type or species of bacteria in the vagina. They produce lactic acid and that keeps the pH low. So the acidity is going to be there and that inhibits the growth of harmful bacteria which could then cause problems for the health of the woman and also in terms of pregnancy risks, etc. So what we want really is a lactobacillus dominated microbiome because that's been associated in studies to show better fertility outcomes and reduce risk of infection, and also some studies reduce risk of miscarriage as well. Next slide. There are other bacteria that can be growing in the vagina as well, and one important one is called ureaplasma. So ureaplasma is a type of bacteria that can live in the vagina and doesn't usually cause symptoms. So this is one of the things. It can cause symptoms, but actually most of the time, most women who have the ureaplasma overgrowth, it doesn't cause any symptoms. And yet, if you have overgrowth in ureaplasma, it has been shown to increase the risk of pelvic inflammatory disease, which can cause infertility, but also it has been shown to be associated with other problems during pregnancy and also reduced chance of IVF success. Now, infections where you have a full-blown infection, this is actually very rare. So most of the time, your immune system will take care of the ureaplasma and keep it under control. But there can be overgrowth. So there is a limit to what amount of ureaplasma is there. Very small amounts of ureaplasma, don't really worry about them. They're not going to be an issue. But if you have an overgrowth of ureaplasma, then that's something that might need treatment. And the treatment is antibiotics for these bacteria. Next slide, please. Another couple of bacteria which are important, so Gardnerella and Prevotella, these are bacteria that you don't really want to have overgrowth with. They are known to cause something called bacterial vaginosis, which you may have heard of, or maybe some of you have even experienced this. It's quite unpleasant. It's famous for causing that fishy odor and itching and discharge, which is grey. But the significance of it more is to do with the fact that it has been linked to increased risk of preterm birth, miscarriage, and also reduced fertility. So overgrowth of these bacteria also will be leading to problems. Small amounts, again, can be accepted, but overgrowth is where we need to kind of step in and give some treatment. And this is the same for most things, is that you want a balance. So the microbiome has different effects. The gut and vaginal microbiome both together can influence even hormones, such as estrogen and progesterone. Hormones that, of course, can affect other things like ovulation, implantation, and overall fertility. So maintaining a very balanced microbiome is crucial for optimal function and reproductive health. You want to have that good distribution in the microbiome with the lactobacillus dominance ideally. Okay, next question. Sorry, next slide. Lifestyle is important. Microbiome is very sensitive. It's very dynamic as well. So, over months or years, it's been shown that, for the same woman, she can have changes in her microbiome, or for the same man even. The microbiome is not something which stays static. Things which affect the microbiome, very much important, is the diet, healthy diet, that will affect the gut microbiome, which eventually can also have an impact on the vaginal microbiome. Stress, medication, especially antibiotics, of course. The problem with antibiotics, especially broad spectrum antibiotics, is that they can kill off, yes, they kill off the bad bacteria that you don't want, which is causing your infection or problem, but they will also kill some of the bacteria that you want, the good bacteria. So it's becoming more common practice now that when you take antibiotics, you're recommended to take also with it probiotics to counteract this effect. Never used to be the case. When I started medical school, we just gave the antibiotics straight without worrying about this microbiome effect. And good diet will involve, of course, diet rich in fiber, fruits, vegetables, antioxidants, and fiber. These are all helpful for the microbiome, and we'll talk about prebiotics later on. And therefore, also, avoiding antibiotics unnecessarily, because sometimes some doctors, sometimes they may be a little bit liberal with antibiotic use and give it when it may not be always required. And we should really try and limit the use of antibiotics to when it's absolutely necessary. So probiotics is giving the actual beneficial bacteria to the microbiome. So for our specific case, of course, we're looking at the vaginal microbiome mainly, and that's going to be lactobacillus. You want to have good amount of lactobacillus. So giving lactobacillus, either orally or vaginally, is the probiotic treatment that we would use. And then you have prebiotics. So this is for the digestive tract, and this is the high fiber diets and healthy foods that promote the growth of beneficial bacteria, which will help improve the distribution, the diversity of the microbiome in the gut, and then that will also reflect in the rest of the body, including the reproductive tract. So using these probiotics and prebiotics, prebiotics is usually you can just do food. You can get ready-made prebiotics, but it's not necessary if you have a good diet. These can both help improve the microbiome and lead to be balanced and improve fertility as well, ultimately. Next slide. So yes, I mean, the microbiome is very important in terms of health in general, but also we are finding out that fertility and pregnancy health are important here as well, because there are some bacteria that you don't want overgrowth in. We know that, and we're still learning, of course. And then there's the lactobacillus that you want to have plenty of. You want to have an abundance of that, because that is like the policeman that suppresses the growth of the bacteria and the microorganisms that you don't want, and it keeps that acidity there, which is very helpful. So definitely these are things that you need to bear in mind. Now, understanding and managing the microbiome may offer improved fertility outcomes and reduce miscarriage rate. However, these are things which are very, very new in terms of reproductive medicine. We don't fully understand it by all means. What we actually know at the moment is the tip of the iceberg. It's quite complicated. Which bacteria exactly are bad and how much is bad and how much is good. Even lactobacillus, there's many different species and subspecies, and which one is good, which one is not so good, how much do you need? These are all things that we don't fully understand. And then the next step is treating the microbiome. What is the optimal treatment? There's so many different types of probiotics and antibiotics, and what is the right way to do it and what is the right treatment. And Valentina is going to talk to you about the DAE test, but there's different ways of testing as well, and so many different things which are on the market, and we're still learning and refining, and I'm sure with coming years this will clarify. There's no standardized process at the moment, so we will get a clearer picture. I think it may take 5 years, it may take 10 years, who knows, but I think we are going to know a lot more because there's so much research which is going into this topic. It is a big topic, and I feel there's a big future in this, so definitely something for us to learn. However, still, even with the little knowledge that we have, I do feel that it's worth testing for microbiome. First of all, nowadays we're doing vaginal microbiome testing mainly, which is quite easy. The DAE kit, which Valentina is going to talk to you about, is a tampon, which women are very familiar using, so that's quite easy. It's not too expensive in the grand scheme of things in terms of tests for fertility. and it's pretty low risk in terms of the treatments as well. So even if we haven't got a complete picture, full understanding, I feel it's still worth testing and treating for the right patient. And then we have seen, I've seen some patients, I felt that their lactobacillus was very low. I think one of the first questions we had, someone was asking about 0% lactobacillus. So we actually did have a patient who had 0% lactobacillus, and with probiotics, she got pregnant, and she's well into her pregnancy now, for the first time pregnant after 5 years. And that's after taking probiotics. So yes, I do feel it may be something worth doing, even if we don't fully understand it, even if I can't say to you 100%, I know that this is going to help or not. I still think it's worth pursuing it, and with time we will get a better picture and better understanding. Thank you.
Thank you so much, Dr. Sami. It was so informative. And I will now introduce Valentina. She's the CEO of the Vaginal Microbiome Testing Company. And Valentina will then give you a bit of more detail and insights about the testing itself, the necessity and how the test performed, and why do we do it as well. So Valentina, stage is yours, and please just give me a hint when you want me to skip the slide.
Of course. Thank you, Dr. Sami, for the presentation, and thank you, Maria, for having me. I'm very excited to be able to work with Plan Your Baby to deliver our innovative approaches to gynecological health to a bigger audience. A bit of context about me. So I suffered from recurrent vaginal infections for a very long time of my life, and that's what really inspired me to create more thoughtful solutions to the way in which we manage vaginal infections today. I genuinely believe that the human microbiome right now is in a position where it might become entirely extinct due to a number of different factors ranging from our diet to stress. But a key component to why particularly the vaginal microbiome is becoming less and less populated with lactobacilli is the way in which we treat vaginal infections today. So we're currently over-reliant on antibiotic and antifungal treatments, and we very rarely account for how these treatments have, a positive impact in the sense of killing the pathogens, but also a negative impact in the sense of killing the good and the bad bacteria indiscriminately. So with that, a bit more context about what we do. We've developed two solutions for vaginal health. The first one is a diagnostic, so it's diagnostic tampon. And the second one is the Day Probiotics, which is a clinically validated lactobacilli supplement, which is designed for enhancing the health of your vaginal microbiome. And what we feel most passionately about is spreading more awareness about the relationship between fertility, fertility challenges, adverse pregnancy outcomes, reduced fertility, and the vaginal microbiome, because it's genuinely surprising how few of us are aware of the fact that vaginal microbiome exists or of the role that it plays in our overall reproductive and gynecological health. Next slide, please. So just building upon some of the points that Dr. Sami raised, if any of you are interested in the scientific data between the relationship of the vaginal microbiome and different fertility outcomes, I've linked a few of the definitive studies here. But in brief, what we know is that the vaginal microbiome not only has an impact on how likely we are to experience miscarriage, preterm labor, or ectopic pregnancy, it also influences how susceptible we are to a variety of vaginal and sexually transmitted infections ranging from chlamydia to bacterial vaginosis. And most recently, there's been a consensus in the IVF industry that having a disrupted vaginal microbiome is a key predictor to how likely you are to have a successful IVF outcome. And that's why at Day we feel really strongly that vaginal microbiome screening, given that it's a relatively affordable intervention, particularly in the context of IVF costs, should really be offered proactively to patients who have struggles with reduced fertility or persistent miscarriage. We're very fortunate. One of the key advantages from the horrendous COVID pandemic is that the cost of PCR testing has massively gone down. So vaginal microbiome screening used to be in the range of thousands of pounds, so £4,000, and we're now able to provide it a lot more cost effectively. So there's really no reason why anyone shouldn't check on the health of their vaginal microbiome, given how essential it is in a variety of gynecological health factors. Next slide, please. Another thing that we know is that most of us still feel quite uncomfortable with the standard gynecological health exam. So most patients report feeling a lack of perceived self-competence in testing themselves with the swab. So swabs don't have a mechanism by which you can confirm that you've collected a good enough sample. And in general, people are quite intimidated by the speculum exam, by having to be half naked in front of a stranger. And as a result, many of us don't get screened as frequently as we should. And this is particularly true in the case of HPV and cervical cancer. HPV has also been associated with a decreased likelihood of successful fertility outcomes. And currently in the UK, we only have 58% of eligible participants showing up for their HPV screen and their pap smear. So in this context, we want to create a less intimidating, but also more effective way for people to get screened either at the point of care or at home, but by themselves. So without needing to be subjected to an exam from a nurse or a physician. And tampons being a very familiar tool. So over 90% of people use tampons either on a regular basis or have used a tampon at least once in their lifetime, present themselves as an interesting, less invasive, less intimidating method for sample collection. Next slide, please. What we're able to do, because the tampon covers a much bigger part of the vaginal canal, as you see in one of the next slides, compared to the swab, what we're able to do is with one sample, we can check for a number of different pathogens. So where typically would have to get swabbed multiple times for different conditions, because the tampon is bigger in its surface area and it covers a bigger part of the vaginal canal, we're able to collect more vaginal fluids, we're able to collect a bigger overall DNA mass, which means that then with one point of contact with the patient, we're able to screen for different conditions at the same time. So we can screen the vaginal microbiome, test for STIs and HPV, and also look for specific pathogens like ureaplasma and mycoplasma, which have been associated with decreased fertility. The second key advantage of the tampon is the increased rates of sensitivity and specificity, or the increased rates of diagnostic reliability. So because tampons cover a bigger part of the vaginal canal, and because when tampon comes with an applicator, you're able to reach your cervix by yourself, and to confirm that you have reached your cervix, you're able to collect both cervical fluids and vaginal fluids. And as a result, you're able to get more accurate results. So a lower rate of false positives and a lower rate of false negatives when it comes to gynecological health screenings, whether it be vaginal microbiome screening, vaginal infection screening, or STI screening. And this actually isn't a new scientific discovery. We've known since the 1980s the tampons increase the rates of sensitivity and specificity for gynecological health screening. But we simply haven't done anything with this information until now. And on the screen right now, you can see the increase in sensitivity and specificity when using tampons as a sample collection method. And again, if for those of you that are interested, the publications are linked. This is an overview of the main advantage of using a tampon. So beyond it being more familiar, it covers a much bigger part of the vaginal canal. So it's a misconception that the swab can simply be repurposed for vaginal health. So the swab was designed for your nose and your throat, which are different organs from your vagina. And then, like so many other areas of women's health, it was simply repurposed for gynecological health screening. The tampon, as you can see on this illustration, is able to cover the entirety of the vaginal canal, so picking up on any pathogens that might be hiding in one part of the vagina or another. And it also collects fluids from the cervix. So when you put it in, you collect a sample one time, and then when you take it out, you collect a sample a second time, which increases the overall DNA and bacterial mass that we're able to collect. And what we've created is a very simple patient journey. So you get the kit delivered to your door, or you pick it up from a retailer or your doctor's office. You then answer a quick health context questionnaire, which includes your symptoms and your health history. So professionals like Dr. Sami can assess your overall medical history at a glance. What we're doing with this questionnaire is we're aiming to arm every patient with their data so that they can go and demand the best possible standard of care, but also to save time for very busy nurses and very busy doctors who might not necessarily have the time to obtain your full medical health record or your full history of your symptoms. We then make this data available in a very digestible PDF to the provider, and they can use that to inform treatment decisions alongside the actual diagnostic results. You then insert the tampon as you usually would, you take it out, you place it in the sterile pouch, you use the same box that you received the tampon in to ship it back to one of our partner labs, and then you get your results in a very digestible and easy to understand way. So that's a short introduction to what we do, and very, very happy to answer any questions that you may have.
Valentina, thank you so much. It was so informative. So what I will do, I will stop sharing the screen, and I guess we have a lot of questions. So what I'll do, I will start to read the questions. We'll start from the first few we received, and yes, so please feel free to answer to them. So the first question is exactly about the result showing 0% of lactobacilli. Does that affect implantation, and what can the patient do about it now and going forward? And what would be the best treatment for Mycoplasma hominis?
Okay. So yeah, I think these questions are from the same person. So first of all, with the mycoplasma, if it's a significant amount of mycoplasma, which the test should tell you, then I would give antibiotics, doxycycline, clindamycin. But yes, I would give antibiotics to the male and female partner together. And that would be the first step. Alongside that, you would take oral probiotics. And then following completion of the antibiotic, I would also say with 0%, I think the oral probiotics, they do help, of course. Problem is that we used to have Canesflor, which is a widely available vaginal probiotic, which until about 6 months ago was very easy to access. That's not available anymore in the UK. We haven't got any replacement for it. So even though in the US there are many, many different preparations for vaginal probiotics, in the UK there isn't really anything dedicated towards that. But I would say with a 0% lactobacilli, you need really something vaginal to work quickly, because the oral can take 2-3 months, sometimes more, to actually have an effect on the vagina and do what it needs to do. Whereas giving vaginally should be a lot faster, because you're putting it directly to where it needs to be. So what I've had experience with is actually using the day probiotics vaginally for such patients. So I recommend that they take it vaginally. And usually we start with a course of them taking it daily for 7 nights. You take it every night for 7 nights, and then twice weekly thereafter. And just continue with that. Now, this hopefully will improve the lactobacilli count. We don't always get to 90 or 80% or more, but even without getting that high, I've seen people, they are achieving pregnancy, and it's a healthy pregnancy, as long as they kind of carry on with the probiotics. And usually if there's a pregnancy, I would recommend just to continue on the oral probiotics, but until then, the vaginal probiotic as well as the oral together, I think would be a good option. But certainly get the antibiotic out of the way first, alongside using the oral probiotic with that, because that's important to do as well.
And if I can just add a bit of context on the day probiotic here, the formulation that we came up with is a single strain. So it's GOP plantarum 35, which is being clinically validated for its efficacy in increasing the rates of lactobacilli in the vaginal environment, and also fighting off candida, which is one of the most commonly found pathogens in the vaginal environment. And we designed it so that it's just the lactobacilli. So if you have used it, or if you have a box, you see that it doesn't have a shell, it doesn't have any type of gel or filler in it. It's just a freeze-dried lactobacilli in a hard compressed tablet form, which makes it suitable for vaginal use. But unfortunately, the regulations in Europe and the UK have changed now, and vaginal probiotics are only available via prescription.
Thank you so much, Valentina. Dr. Sam, would you like to add something?
No, I'm ready for the next question.
Okay, we have really a lot of questions. The next question would be, so how do you treat Prevotella? So what can be done?
So again, similar to the Mycoplasma, Prevotella, Ureaplasma, the treatment, if you have a significant amount of it found on your test, is to take antibiotics. And always with the antibiotics, you should take the probiotics like we described before. So, we need to make sure it's a significant amount, because small amounts are fine, but overgrowth is not good for your fertility. And overgrowth of Prevotella, Mycoplasma, Ureaplasma, Gardnerella, all of these things, if they are too much, you want to get them down, and the lactobacillus can help with that, but also you need some antibiotics, usually if they're too high.
Mm-hmm. Thank you. Another question, very similar, but I think it's we should answer it. In regards of the recommendations, what can be recommended after a course of metronidazole given for BV and low percent of lactobacilli?
Okay, so I think this is similar to what we've just answered, in that you need to, once you complete your antibiotics, you need to take probiotics, and definitely 0% lactobacilli, I think orally as well as vaginally is advised, because you want it to come up quickly, and it's starting off at nothing really.
Yeah, I have next question. It's very interesting actually, and I'm quite curious to hear the answer. So the lady had done a bunch of work on sodium lauryl sulfate and vaginal microbiome. SLS is highly toxic to lactobacilli, yet it is an ingredient in progesterone suppositories, which actually is widely used during the fertility treatment and pregnancy. And patient is wondering if we have any references for concentrations of SLS and toxicity to microbiome.
Yes, very interesting question, this. So sodium lauryl sulfate, or SLS, is a detergent. It's widely used in cleaning products, and of course things like shower gels and shampoos, etc. So it's something that we a lot of us will put on our body quite frequently. It's not toxic in itself, but yes, to bacteria in certain concentrations it can be. Now, there is use of this in many things, and yes, the progesterone suppository may contain it. Usually what we recommend actually is not to use the progesterone suppository vaginally. My preference is that it's used rectally. It has exactly the same effect. It's a bit easier usually. It's less likely to fall out. It's less messy in general. Yes, sometimes it can cause irritation and you may have to use it vaginally, but the preference from my end is that it's used rectally, and therefore it shouldn't really have any effect on the vaginal microbiome if used rectally. And I don't know what the concentration is. I haven't got that information. That it will be toxic to the lactobacillus, but I'm not sure if that amount which is in the pessary will be toxic or not. But definitely, I would recommend to use it rectally if you can tolerate it that way. There may be some patients where it's not suitable, those with Crohn's disease or anal fissures or whatever, but these are actually very few patients.
Thank you so much. It's such a great question. Another question. So why would lactobacilli be low? What exactly is causing, just in general, on our day-to-day life?
Well, I mean, Valentina did touch on this, in that maybe modern lifestyle is playing a role in terms of not such a good diet, not enough sleep, stress, medication. Top of the list would be antibiotic use. Sometimes antibiotics are used a little bit too freely. And that's just, taking a shotgun and blasting all the bacteria, where you are killing some of the good bacteria that you want to keep. I wish we had more specified treatment regimens that we could then, specify this bacteria to be killed and that's it. But no, we don't, unfortunately. So these are all things that can cause it to be low. But, there may be other reasons that we find for some women. Perhaps they have some co-infections. There are things that maybe to do with her immune system that could all play a role in why some women have very low lactobacillus counts. And yes, it does surprise me that some women have really low 0% or 10%, and I didn't really anticipate seeing such low numbers when I first started doing these tests.
I remember we first were quite concerned. Is it actually possible?
I didn't think it was going to be that low, and some people having such low, but this is apparently possible that some people have very low counts of lactobacilli.
It was one of the biggest shocks for me as well when we commercialized the diagnostic tampon, to see the volume of patients who have 0 lactobacilli. I genuinely thought it was scientifically impossible.
Yeah.
Thank you so much. Another question, how would you know you have this bacterial overgrowth, and should there be any symptoms, and or it's only the testing that can tell that there is an overgrowth?
Well, there can be symptoms. So with the, it depends on what's overgrowing, of course, but things like bacterial vaginosis, they can give symptoms which are like the vaginal odor may be more fishy, there may be a kind of a discharge, itching, soreness in the vagina, sometimes a little bit of bleeding with the vagina with intercourse. They're non-specific symptoms, so you can't say 100% just from this, but these are possible symptoms. If you have overgrowth of other bacteria that can cause other symptoms. So yes, there may be symptoms, but actually, for a lot of people, and I mentioned like the ureaplasma, for example, it rarely gives symptoms. So for a lot of people, they don't have symptoms. They don't know that they have overgrowth in bacteria which are not good, which is why the test is what really shows us if these people are having it and if they need any treatment or not. Again, I will say that if you have a tiny amount, that's not a big deal. It's just the overgrowths that are a problem. So I'm really happy that we have this facility now to test, because again, in the past, when it came to things like ureaplasma, I used to get a test which would tell you positive or negative. Okay, is it positive but a tiny amount or is it a lot? I didn't really know, and it caused a lot of confusion and stress. Whereas now we actually get more of a quantification. That's really, really helpful in my opinion, because then we know who is the one who needs treatment and who doesn't.
I
One of
think
the
here,
advantages of quantitative PCR, you're able to assess the overall number of pathogens versus just whether they're there or not.
Exactly. Things have moved on a lot.
yes, and actually here I just would like to add that, as you said, Dr. Sami, so the previous methods that all of the clinicians and clinics have broadly available just as a urine test, now it's becoming for clinicians much more complicated to make a correct decision about the antibiotics, especially. So if, let's say, for example, the growth is insignificant, then perhaps patient may benefit from the probiotics rather than just giving antibiotics that can harm more rather than benefit. Okay.
In a lot of different kind of international public health systems, it's the norm to always prescribe probiotics alongside the course of antibiotic treatment. It's not the norm in the UK, but in a lot of other public health provider systems, it is the norm.
Yeah, it is. And the good thing is now probiotics are so widely available, so easy to access. So even if your GP or whoever is prescribing antibiotics isn't recommending or giving you advice about probiotics, you can still obtain them yourself.
Thank you so much. We have another question. Lady is curious whether the microbiome can have a negative effect on ovulation itself and cause low progesterone and a short luteal phase. That's a very interesting question, I must say.
That's a good question. I mean, the answer is I can't say for sure. So there has been some research which suggests maybe having a microbiome which isn't balanced could impact also hormones like estrogen, progesterone, and that could then lead to things like low progesterone and short luteal phase, etc. But it's not conclusive evidence yet. Maybe in the future we'll know. So it's possible. It's certainly not top of my list when I see someone with a short luteal phase or low progesterone. There are many other causes for hormonal imbalance other than the microbiome, but it could be one possible cause.
Thank you so much.
I haven't looked at any literature on the topic, sorry.
That's okay.
Yeah, we have another good question. One lady is asking, so her vaginal microbiome just showed a prevalence, which is 98% of bifidobacterium brief, and she has not found a lot on an information about it, and should she worry about this? And some papers say it is a dominant flora in up to 15% of women. Can you give any advice?
Okay, yeah. This is very interesting, actually. So the thing with microbiome and what is good and what's not good, we don't fully understand it yet. That's the truth. And people are so different. There's such a variety. This is something which every woman has a variation, and even the same woman, this year compared to last year, her microbiome is going to be different. So we do feel that some people may have a different type of balance, which still could be healthy. And even when it comes to lactobacillus, which lactobacillus is good, which is bad, there's a whole lot of conflicting data out there. So yes, I have seen some research which says that this bifidobacteria could be actually as good as lactobacillus and healthy as lactobacillus, and it didn't show in the studies that they did in negative outcomes in terms of fertility. So yes, it's possible that your microbiome is, bifidobacterium dominant, and yet still it's a healthy and good bacteria. So I don't think you need to panic about this or worry about it, but hopefully with more research, with more time, this will be clearer and we'll understand it better. And yes, maybe it's just a variant. And there are lots of things in medicine where, not everyone's the same, and there are variations, and you could have a different bacterial strain which you tend to grow, and that's fine, and it's healthy for you, it keeps you healthy. That's not a problem necessarily. I don't know, Valentina, have you read much about this, bifidobacterium? I've only read 1 or 2 papers actually on it.
Yeah, it's still nascent, the research, and that's so actually that's an interesting point that I think we need to address. I often get the question of do we actually know enough about the vaginal microbiome? Is it similar to the gut microbiome where we can't specifically address clinical conditions to the presence of certain bacteria? And it's important to remember that the vaginal microbiome is a lot less complex to the gut microbiome, and we actually have a lot more long-standing research on the vaginal microbiome than we do on the gut microbiome. So there are less bacteria in the vagina than there are in the gut, and for more bacteria that are present in the vagina, we have specific clinical implications that we're aware of. That's one of the points about the data diagnostic kit, is that we focus on clinically significant pathogens. So we're not going to test for any bacteria or pathogen for which we don't know what to do with, because that's just a frustrating experience for everyone involved, the patient and the physician. We only test for pathogens for which we know there's an established clinical pathway and there's enough of a scientific consensus on what it means that you have or you don't have this pathogen. But the research on the vaginal microbiome could definitely be enhanced. It's one of the many examples of the gender health gap that we don't have more data on the vaginal microbiome, and that's one of the key aims that we have at DAY. It's to help bridge the gender research gap when it comes to the vaginal microbiome. So we continuously conduct clinical trials, and we publish them in peer-reviewed journals to help advance the scientific consensus on the vaginal microbiome and its role in, as I mentioned at the beginning, really a variety of gynecological health functions. So fertility is just one, but we now have evidence that the vaginal microbiome is also associated with how quickly you will clear an HPV infection and prevent it from turning into cervical cancer. And there also appears to be a correlation between the vaginal microbiome and chronic gynecological health conditions like endometriosis and polycystic ovarian syndrome.
Thank you so much. It's been quite informative, and it's such a great question. Another good question. So what is the evidence basis around the use of vaginal probiotics? Asking you to recognizing the significant difficult sourcing vaginally delivered probiotics in the UK. Is there any concern around the efficacy, and what is the difference between orally and vaginally delivered probiotics?
Okay, so orally, it's very clear. You take it through your mouth, it gets absorbed through your gut, and then, eventually there will be a balance in the gut, which would then impact the rest of your body, including reproductive tract. Vaginally, it's direct administration. You're putting the bacteria that you want straight there where it needs to be. So there's no doubt that this is, the preferred route, at least the faster route to give the probiotics. Now, the evidence is still building with regards to using vaginal probiotics, and I think she's asking about fertility here. So, for example, for IVF success rates, there have been studies that show that when you have low lactobacillus and you treat with probiotics, that this may improve the outcome. It may be in other studies that it can reduce miscarriage rate, but there have also been studies which have shown that there's no difference in lactobacillus depleted women where they've given probiotics or they've given placebo. And they haven't found a difference in the success rate. So that's normal with medicine. Studies will show this, studies will show that, and then it takes a long time when you have huge numbers of patients and many studies that you can look at together and do things like meta-analysis, etc. Then we can kind of make more conclusive answers. We're not at that position yet, and I don't think we're near that position yet to say that there's enough evidence to say that, yes, if you take this probiotic vaginally, then you're going to have a better IVF success. However, saying that, the drug, or it's not even a drug, it's the probiotic is very safe, and not too expensive. I know there's a cost implication still there, but compared to IVF cost, it's it's not a fraction of that. And what's the harm? So in my opinion, if you have lactobacillus depletion, then I would want you to take the probiotics ideally, just because of that evidence that's there and that chance that it could make a difference for you and improve your chance of success. So I can't say there's solid evidence yet, although I do believe it will build, and there will be eventually enough evidence to show us and guide us and tell us, which lactobacillus, how much of it, how is the, there's no standardization at all now. Everyone's kind of still learning it. But I don't think there's much harm, and the cost isn't too high. I think it's probably worth a shot.
Yeah, that's the other big question about probiotics. There's so many differences between the formulations that are available in the market, their bioavailability in a vaginal environment, and most of the probiotic research that has come to pass so far has been focused on the gut microbiome. So the vaginal microbiome, by virtue of being a women's health specific condition, hasn't received as much funding and research attention as say the gut microbiome. And in order.
Party.
Is
Don't stay too late. Don't miss your train.
As Dr. Sami was saying, in order for a medication or medical intervention to be approved and widely adopted, it needs to go through multiple rounds of randomized controlled clinical trials with quite large patient populations, which can be very costly. We're talking millions of pounds or millions of dollars here. So private companies can rarely afford to fund these types of trials by themselves unless they're large pharmaceutical companies. So we really need a public health intervention here in the sense of probiotics, and we need to attract more public funding, given that we have issues with antimicrobial resistance, we have issues with zero levels of lactobacilli being found in patients, but it takes decades for this type of research to be funded and then accumulated and peer reviewed, and for it to go through NICE guidelines. There's usually a 10 to 15-year delay between when we make a scientific discovery and when it becomes part of NICE guidelines. And then there's also the question of public health economics. So as Dr. Sami mentioned, probiotics are found to be generally safe. Lactobacilli are naturally found in our surrounding environment. We ingest a lot of lactobacilli through foods like kefir, yogurt, kimchi, etc. So the FDA, for example, the Food and Drug Administration in the US, considers them to be a grandfather status product, given that they have a long history of safe use in humans. Now, European regulators are taking a different approach, but at present, I haven't found any evidence, and Dr. Sami, let me know if you found differently, but I haven't found any evidence that probiotics are unsafe. There's varying degrees of efficacy in different probiotic strains and formulations, which is to be expected. I think we need to do a lot more scientific research in order to develop specific probiotic strains for specific gynecological diseases.
Thank you so much, Valentina. Another very interesting question that we didn't touch yet. So after the treatment has been taken to improve the microbiome, should the patient do the retest, and how frequently the retest should be done of the microbiome?
Okay, that's a good question, actually. So for my patients, I mean, again, there's no standardization here. This is kind of just my practice. If they have very low lactobacillus, 0%, 20%, 40%, maybe up to 60%, then I will want them to retest after 6 to 8 weeks if they're not pregnant. I'll ask them to retest after 6 to 8 weeks of taking the vaginal and then oral probiotic. And then we can see where we're at. And sometimes we do need to kind of change strategy, tweak things a little bit, or just maybe give a bit more time to see if the lactobacillus will build up enough. If the lactobacillus is reasonably high, 60% or more, then I just start the probiotics and I don't ask the patient to retest. I don't see that being necessary, really. So yes, it depends kind of on how much lactobacillus is there as to when to retest and how important it is to retest. Maybe even if it's been normal, or if you've had a treatment and it's been a year or so, I might want to retest as well, because the microbiome is very dynamic and affected by so many things that it might be worth just keeping track of that. And the test, thankfully, at the moment isn't too expensive. Currently, it's around £100 for the daily test, so it's not too big a cost, especially for someone considering an expensive treatment such as IVF.
Yeah. And then there's also the life stage approach. So when you're moving through different stages of life, it's a good idea to check in on your vaginal microbiome because it can tell you different things. When you've stopped antibiotics or antifungal treatment, it can tell you the impact that this treatment has had on your microbiome, and then pre-conception, after delivery, when changing sexual partners. And then there's also the relationship between the vaginal microbiome and menopause. A lot of the hormonal replacement therapies will have an impact on the vaginal microbiome. So knowing that there's a disruption can empower you to take action and change your lifestyle, so that you can repopulate your vaginal microbiome with healthy lactobacilli, which can decrease the risk of UTIs and recurrent vaginal infections, which are common in menopause patients.
Thank you so much. I have another good question. What vaginal probiotics can you recommend at the moment present on the market? And just to say, any probiotics that will be mentioned here, it's not an advertisement. Okay, so just a recommendation. Perhaps maybe you know that Dr. Sami in your practice.
I used to use the Canisflor, but that's not available anymore. So the vaginal route isn't really available here in the UK. I've seen some of my patients, they've ordered from America the vaginal probiotics, and they've used those, and they seem to work nicely. But that's not always easy or practical, and it's definitely more expensive. So at the moment, I'm using the day probiotics because, as Valentina mentioned, it's a kind of safe to use vaginally. It's just the lactobacillus. It's not got lots of different ingredients and products that may cause harm or irritation to the vagina. That's because I don't know anything else which is suitable really to use vaginally. Maybe at some point we'll have other preparations that we can look into, but for now I don't think there is anything available vaginally on the market.
Thank you so much. Then we have a very good question actually, and I also want to hear the answer. So during the IVF, at the egg collection, lady needs to have antibiotics because she has a history of tube ovarian infection. So will this affect the microbiome before the transfer, and how can we mitigate this and reduce the risk?
Yeah, it's a very good question actually. So this lady must take antibiotics with egg collection. She's a high-risk patient. The last thing that she would want is to have egg collection and then end up with sepsis or another tube ovarian abscess or something very serious that's going to even more impact her chance of getting pregnant with the embryo transfer for sure. So you must, I'm not trying to put fear in taking antibiotics. Antibiotics are a necessity for many situations. But if you take the probiotics with that, it will negate the harm. And the good thing about this lady's situation is that usually they just give one shot of antibiotics. So you just take it with the egg collection. It's not a prolonged course of antibiotics, which is going to cause more harm. So the disruption to the microbiome should be more limited with that. And if you're taking probiotics anyway, then I don't think it's a big deal. And certainly even for me, when I would give antibiotics to women like this, and I've seen many of these women, most of them will get pregnant. In fact, I've worked in an IVF clinic where they gave every single person doing egg collection antibiotics. And success rates are very good. So, I don't think that one shot of antibiotic is going to be a problem, really.
Thank you so much, Dr. Sami. Okay, another question which actually I observed in many patients, and everyone is now talking about the new innovations. So, so we'll try to answer to this lady. So what exactly is the difference between the Alice and Emma, which is the endometrial microbiome test performed through the invasive procedure, versus the vaginal microbiome, like a day test, and any pros versus cons, and is the Alice and Emma test really beneficial? And I just want to specify this test is done quite often for the patients who are undergoing IVF treatment.
Yeah, I think it's pretty much only done for IVF patients because you have to do it with an IVF cycle. Okay, it's a very good question, actually, quite a nice question that someone's asked. So we have two microbiomes that we are talking about here. One is the vaginal microbiome, one is the uterine. And when I was in medical school, I was taught that the uterus had no bacteria, it was sterile. That's what I was taught. Of course, we know now that's not true. But they are microorganisms there. It has its own diversity, it has its own microbiome, which could be healthy or not. but actually the load of bacteria, the amount of bacteria is very tiny in comparison to what's there in the vagina. The vagina is full of bacteria. Of course, the gut has millions and millions of bacteria, billions in fact. But the uterus has its own amount, but it's very, very tiny amount. It's a very small amount. That's important to bear in mind. The other thing which is important to bear in mind is that the thing that divides the uterus and the vagina is the cervix. And when a woman is not in labor or delivering a baby, the cervix is closed. We call it closed. Now it's not a closed system at all. Of course, we know it's not closed because menstrual period comes out and sperm goes in, and there is a channel there which if sperm and blood can travel it, then of course microorganisms can even easier travel through that. So it's not that they're completely separate entities here. And therefore, we hope that testing the vaginal microbiome will reflect the uterine. Now,
some bolognese right now.
Oh, yeah. No.
Whoever's listening, can you have your microphones on mute, please, so it doesn't cause background noise. So, with regards to pros and cons, so the pro of doing the uterine is that if it is uterine truly, and I'll talk about that in a second, then it's kind of talking about the actual place where the implantation is going to happen, which is our focus. We're not implanting the baby in the vagina; we're implanting the uterus. So if we can get a very clear, accurate picture easily for the uterine microbiome, then that's fantastic. So that's really the only pro I think I can think of. Now there are many disadvantages. Number one, the test itself is very invasive. So to do the uterine microbiome test, you actually have to insert a tube into the uterus, which could be an embryo transfer tube, IUI, a catheter, or a lot of people are using even like more harsh catheters like the Pipelle catheter, which is used for biopsying for cancer, to obtain like cells and then sending that off for testing. And it's quite invasive. It's quite painful. Some women don't even tolerate it, and some women have a very tight cervix. It's very hard to get through. It's a real struggle sometimes to do this. And of course, not something you want to keep doing again and again. So that's definitely a big disadvantage. Also, it's quite expensive. It's a lot more expensive than doing vaginal testing, a lot more. And then probably another very big disadvantage of doing uterine microbiome testing compared to vaginal is that because the microbial load is so low, the actual risk of contaminants is extremely high. So if you get any bacteria which is coming through, and of course to get to the uterine you have to go through the vagina, through the cervix, it's extremely difficult not to pick up something on the way, or even from just from the external environment, from the gloves of the doctor who's doing it, from the laboratory. There's all these places where you can get contaminants. And when you have a high microbial load and then you do the PCR, PCR means you're amplifying, you're multiplying the amounts. So if you have a small amount of the bacteria that's actually there in the uterus, but you also get some from the outside, a small amount, that's going to amplify and completely distort the picture. Whereas in the vagina, because you have such a high load, you don't really see this effect. So a lot of the studies which have been done on uterine microbiome, there's a lot of doubt as to how accurate they are. Or some of them, they have actually done a control. So when you look at these studies, you should look and see, have they done a control to compare, is it a valid result or not? Because there is extreme difficulty in getting an accurate answer as to what the uterine microbiome composition actually is. And even now there's a lot of development trying to develop techniques. Maybe you use two tubes, one to go through to the cervix and then a second tube which will go into the uterus. Different techniques to prepare the actual test. So there's development which may help us to get a more accurate answer about this, but at the moment I don't think it's a very accurate way, and it's not very good. It's expensive, it's painful, not something you can repeat. So definitely for now I'm sticking with vaginal testing, and I've moved away from uterine testing completely until maybe at some point we have something which is better.
Thank you so much, Dr. Sami. I just noticed that we have so many questions still left not answered, and we are just slowly running out of time. So I still would like maybe to ask a few more questions, and if we can help as many ladies as we have today. So another good question was exactly about the past infection. So the lady had about a BB about 10 years ago, treated with antibiotics at the time. Could that one instance have effect on fertility?
Well, I don't think one course of antibiotics will have such an effect, and especially with BV, usually it's metronidazole which is given, and I don't think that in itself is going to have such a big impact. You know, it's unlikely, especially since it was such a long time ago, and the microbiome is dynamic. So even if you did have it affected for a while, you should have built up a new microbiome by then. So I don't think, no, 10 years ago, one bout, I don't think that would be something which will cause a long-term damage to your fertility forever.
Thank you so much. There's another very good question about the probiotics. So there are Acidophilus pessaries available in the UK. What about Giantima vaginal pessaries? No prescription required. Does they offer a similar or better product?
So yes, I mean, Giantima is a bit different in that Giantima is there to kind of increase the or reduce the pH, so make it more acid. Which can then help to balance the system and improve the chance of lactobacillus growing. And I have used it sometimes in some patients, the Giantima probiotic. It comes in forte and regular. It's not quite the same as the probiotics from Day, in which you have like a concentrated amount of the lactobacillus, which is I think important. And I've seen that some women get quite a lot of side effects with it. It can cause burning because of the acidity effect from the Giantima. It can cause also a lot of discharge, and it can be quite irritating sometimes to the vagina. I mean, I have used it for some patients where we've had problems and difficulties, but I wouldn't start with the Giantima for sure, no.
Thank you so much. Okay, a few more minutes left, but let's try to answer one more question. One lady
happy to stay a bit longer if Dr. Sami is available as well. I'm happy to stay a bit longer.
Fantastic. Thank you so much. So one lady is asking for us to clarify, do we suggest a male partner to take probiotics as well?
Well, I mean, this is a very good question, because when we talk about fertility, there's two partners here. It's not just the woman, of course. And definitely the men have their own microbiome, and their own microbiome has also an important role to play here. And there's a joint microbiome, the fact that they're having intercourse and trying for a baby, that in itself is going to impact on both ways. So yes, I mean, it's important, I think, for the man to have a good diet, good health, good microbiome for himself, and probiotics may help with that. We, again, don't understand a huge amount about the male microbiome and what's considered to be good and what's bad and what needs treatment. But when I do encounter a woman who has overgrowth in things like ureaplasma or mycoplasma, or these things which could be transmitted through intercourse, then definitely I would recommend, when there's a high amount, that the male partner also takes some antibiotics with probiotics to counteract that. But it's important, I think, yes, that the man is also important here, and probiotics is quite easy and safe and probably a useful step to take.
Thank you so much.
I think there's an important point here to mention around the sperm microbiome. So we talk about the vaginal microbiome a lot, but the sperm has its own microbiome as well, which is not that well understood currently. But we know that if the male partner has mycoplasma or ureaplasma or desorption to their sperm microbiome, that can be passed on to the female partner as well.
Yes, that's absolutely true. Very interesting question as well. So when you talk and say probiotics, do you also mean the patient should take prebiotics, because one without the other is said not to be effective?
Well, that's true, but prebiotics, you don't have to take them if you're eating a healthy diet, and that should cover you. Lots of fruit, vegetables. You can look up and see what diet you should be doing, and it's not essential that you take separately, pills which are prebiotics if you have such a good diet. I don't believe that's the case, that you need to take also prebiotics orally.
Mm-hmm. Thank you so much. Just about some brands questions. So BioCare has vaginal pessaries, which contains lactobacillus as well. And would you recommend to try them? Can it be considered as alternative to Canis Flor?
Okay, I'm not familiar with this brand. Is it, if it's available in the UK, and if it's a vaginal, it's made for vaginal use, then yes, it may be. If it's lactobacillus dominant, you can look at what type of lactobacillus is there and compare it and see if it's something similar to the Canis flora, then I'm happy for patients to use that. Maybe we can look into it as well and see what we think. But I wasn't familiar that there's any available preparation currently, which is actually licensed for vaginal use.
Thank you so much.
Unless it's coming from overseas, that's different.
Yes, that's different. Yes. Then, Dr. Sami, what can the patient do on a regular basis to prevent herself from the infections we talked about? And if she gets pregnant, how would you check her? Like, what kind of test she needs to do in week 4 or 5 for the exactly infections we've talked and the microbiome? Should pregnant patients, when they achieve pregnancy, consider to test themselves, to test microbiome?
Okay, so I mean, first of all, I wouldn't always call this infection. I would say more of an overgrowth of these bacteria, because they don't necessarily in themselves cause problems like an infection where there's an inflammation of cells and you know, there's a lot of symptoms and problems that you can identify from that. So if you do maintain a healthy lifestyle, like we said, in terms of diet, trying to get enough sleep and rest, you know, avoiding antibiotics when they're not necessary. These are all going to maintain a good microbiome, and they should that good microbiome should then reduce the chance of you getting the overgrowth and the bad bacteria. So definitely, healthy diet and lifestyle is important. You may want to take oral probiotics as well, just to make sure that you're having enough probiotics in the gut, which will then reflect in the vagina eventually. And then maybe if you have tested and you have problems, you could take the vaginal probiotics as well. But I wouldn't routinely give vaginal probiotics for women. And I wouldn't necessarily test week 4 or 5 with microbiome testing. I wouldn't necessarily do it at that point. Usually we like to do the preparation in advance of the pregnancy. So before the woman's pregnant, we'd like to do the test. Tweak it if we need to give antibiotics and things. It's more restrictive when you're pregnant, so I would prefer for the test to be done beforehand.
Thank you so much, Dr. Sami. I think also Valentina was trying to help us, and she was very kindly typing the answers to the patients. Thank you so much. I mean, it's been an honor to have you both for this webinar, and it's been so informative, and it's such a huge topic. And I'm sure Valentina also knows that as a clinic, that trying to help patients to achieve pregnancy through the non-invasive approach first, and then with that through the IVF, we do try to, you know, not only do the microbiome test, but all of the other things that can help patients to achieve pregnancy. And again, it's a huge field that still needs to be discovered. But so far, we've seen some cases that really surprised us. The patients unfortunately suffered with a long infertility, and within the 3-4 months, by adjusting the microbiome, prescribing them the probiotics, they achieved pregnancy. And for me, it's already considered a huge success where they've been told that they need to have IVF. And so we have recorded the session. We will publish it on the YouTube, and you can go back and listen to all of the questions. For those who feel that we didn't answer their questions, please feel free to email to Dr. Sami to info@planyourbaby.co.uk. You can also contact their team and email Valentina and her colleagues. And yes, and we will try to do more webinars in the future and to cover more topics.
Yeah, we do these webinars every 2 or 3 weeks. So if you follow Plan Your Baby, then you'll probably be up to date with what's happening.
And thank you so much for everyone who joined. And Valentina, exceptional thank you for joining and finding time.
No, this was wonderful, and thank you so much for all of the incredibly smart questions. And Dr. Sami, it's always a privilege to learn from you and to hear more about your clinical experience.
Thank you for coming and helping us, Valentina. It's been amazing having you.
Thank you. Have a good night, everyone.
Thank you, everyone. Speak soon.